We are all grateful for emergency medicine, which is excellent in life-threatening situations. But what about the medical treatment of disease, specifically the understanding of the cause of disease? This video series explores a precise, scientific model for understanding at a root level changes in the human organism commonly referred to as disease. This understanding makes new care strategies for a wide variety of diseases possible, for common illnesses like a sore throat, as well as chronic illness like diabetes, or even life-threatening diseases like cancer. All those interested in this topic are warmly invited to this introduction, although it is likely that a period of time will be necessary to integrate this new understanding of sickness and health into your thinking. In this part, we begin with why a cause-based therapy in conventional medical models has so far rarely been possible. In many diseases, the cause is declared unknown, or is speculated to be, or is not fully explained. Also, viruses and bacteria are frequently blamed for an illness because they are, in many cases, present during the illness. But this explanation is just as suspect as blaming the police for causing traffic accidents just because they happen to be present at those we observe. Who is present at an accident gives little insight into who or what actually caused it. Indeed, the same germs in the same quantities can also be found in healthy people if you make the effort to search for them and then share what you find with the world. If a cause is actually identified, there still remain unanswered questions. A few short examples. With osteoarthritis, for example, in the knee, an operation can often help alleviate the complaints. However, the famous experiment of the surgeon Bruce Moseley has shown that the results are identical if this surgery is deliberately faked. This is known as the placebo effect, which leads to many contradictions in conventional medicine, as how can these symptoms be alleviated by a sham operation? We have all believed since childhood to understand how cavities form. We eat sugar that gets stuck between our teeth. Bacteria feed on the sugar and produce acid. The acid attacks the enamel, leading to holes. Now, if cavities usually or always occurred in pairs, then this explanation would be plausible. But this acid is apparently unusual in that it almost always harms only one side, leaving the neighboring tooth unaffected. The following is well known. No sooner than the stress of everyday life is lifted by the weekend or a vacation, then you fall ill, a phenomenon known as leisure sickness. It is said that the immune system is weakened by stress, and thus made susceptible to infection, unable to react to the arrival of bacteria and viruses. At this point in the explanation, one is curiously not sick. It's as if a horde of barbarians stormed a castle that is presently unable to defend itself, but for some reason they abstain from burning the place to the ground until the denizens can mount a defense. Blockage of major vessels is cited as the cause of heart attacks, although there are studies that show that collateral vessels compensate when blockages occur, illustrating a major difference between observation and theory in heart attacks. Large mammals have far more cells than small ones. They should thus experience more frequent malignant cell degradation in the form of tumors, since there are simply more cells that can degrade. This, however, is not the case. An observation called PTOs Paradox is well known to medicine. Such contradictions can be found in a variety of disease images. Often, the description of a serious illness runs as follows. The risk of falling seriously ill to sickness X increases if you belong to a certain age group and if you smoke. One sex is more at risk than another. Those who are ill with sickness Y are twice as likely to fall ill to X. The immune system plays an important role, which is in turn influenced by nutrition, athletics, and countless other factors. Genes are further believed or declared to influence this risk. It is also speculated that data, such as your place of origin, and too much or too little exposure to the sun also influence this risk. A special virus is implicated in 90% of all cases of a specific variant of this disease. With so many suspected but hardly controllable influence factors, it is clear why cause-based therapies have remained exceedingly rare. Instead, symptoms have been treated with great effort and many side effects. This woman, for example, has been diagnosed with breast cancer due to a tumor affecting her mammary glands. Our present society is of the opinion that a radical program consisting of surgery, radiation, and chemotherapy is necessary. In subsequent parts of this video series, we will see that step by step, new perspectives and treatment options will present themselves if consideration is given to the cause and course of the illness. Because perhaps individually verifiable, predictable, and precise laws exist that explain the cause and course of an arbitrary disease, which can be verified by most so afflicted with little effort, and that resolve the above-mentioned contradictions and ambiguities? Discover them in what follows, if you are so inclined.